the patients that she told not to call an ambulance if they were to suffer any medical complications.
It is the #1 most deadly operation.
Not only was she not paying full attention to her patient, she was also... It's bad enough a brazen and audacious imposter passing him or herself off as a suitably certified and experienced plastic surgeon, only to repeatedly botch their surgical operations and leave patients disfigured and devastated. The doctor who injected industrial-grade silicone into Priscilla Presley's face was sent to prison and subsequently deported back to Argentina from the US. That type of silicone generally can't be removed from the face. Priscilla is disfigured for life. Or to seriously damage a person's health, leading, in some highly unfortunate cases, to death.
How did Cardi B's butt almost kill her? Before she was famous, she was convinced that in order to make more money, she had to have a bigger butt. So she met a fake nurse in a basement in Queens, and she paid the fake nurse $800 to inject silicone into her buttocks. Even though she developed leakage from her buttocks for several days, she still wanted to go back for a second treatment. But she couldn't because that woman was arrested because somebody died from these injections. So now Cardi B has to settle with what she has.
But what possible excuse can a board-certified plastic surgeon of 13 years have for, say, perforating someone's intestine in the course of a liposuction procedure, or leaving a tummy tuck patient unable to stand after their surgery? Cosmetic surgeon Dr. Roxy Graw, whose licence to practice was revoked on November the 18th, 2022, is, as at early 2023, being sued by 3 of her former patients for a range of complaints. Dr. Roxy's social media content earned her nearly 1 million TikTok followers and over 120,000 Instagram followers, not to mention hundreds of thousands of dollars, I think, from the business generated by her TikTok and Instagram presence. Her clinic, Roxy Plastic Surgery, located in Ohio, America, having been, I'm led to believe, very busy. As attested by countless online reviews, not only on Dr. Roxy's own social media, but also on realself.com, say, Dr. Roxy's patients, often experiencing a new lease of life after a breast augmentation or a facelift or a nose job from Dr. Roxy, adored her. That doesn't include the considerable number of patients of hers whose procedures she botched, or the patients whose surgery she live-streamed without their consent, or the patients that she discharged without giving them post-operative instructions, or the patients that she told not to call an ambulance if they were to suffer any medical complications in the first few days after their procedure.
A TikTok doctor had her medical license suspended for alleged botched surgeries, live streaming procedures on TikTok, potentially without patient permission, and telling those patients not to call 911 if they had medical complications.
Following a number of complaints about Dr. Roxy's professionalism, in October 2018, Ohio's medical board issued Dr. Roxy with her first warning. Her second warning came in September 2021, and it was accompanied with a directive for her to retrain in the procedures that she'd previously botched. Having been admonished back in 2018 to maintain the privacy of her patients when sharing any photos or videos of them on social media, Dr. Roxy was, in 2021, also ordered to undergo training courses in professionalism and ethics, an instruction that she duly followed, I believe. Dr. Roxy's licence revocation of November 2022 was on account of her continued failure to maintain the privacy of her patients, which took the form of her publishing videos of her pre-operative and post-operative consultations with patients without their consent, and of her live streaming some of her surgical procedures, again without her patients' consent. There was at least one live stream in which Dr. Roxy interacted with viewers while performing the procedure. That led to her subsequently being condemned for paying more attention to the camera than to the patient. The BBL, Brazilian butt lift, is the single most risky cosmetic surgery procedure, say cosmetic surgeons themselves. The aim of a BBL is to give a woman an hourglass figure, and it's done by removing fat from the abdomen and the lower back and then pumping it into the bottom. The problem with the procedure is the risk of fat embolism. This is a situation where fat enters the bloodstream and then travels to the heart or to the lungs. That complication is usually fatal, and in the last few years, a number of women from around the world have succumbed to it.
Last week, a British woman died while she was having this bum lift.
That as opposed to getting into the areas that you want it, the fat gets into the large veins, it goes up to your lungs and blocks the circulation to your lungs. That's called a fat embolus, and that kills people. In Florida, in the last 6 months, this has happened 12 times.
In 2017, 692 surgeons from across the world found that 32 patients had died from fat embolism.
It is the #1 most deadly operation in plastic surgery.
With only less than 100% of a surgeon's attention, a patient is put at unnecessary risk. So in Dr. Roxy's infamous interactive live stream in which she performed a BBL, not only was she not paying full attention to her patient, she was also unnecessarily increasing the risk of complications in an already highly risky procedure. The actual patient in this case, who we'll call Sarah, has since revealed that Dr. Roxy didn't give her any written instructions for managing pain or any other post-operative complications. 5 days after her BBL, Sarah was sent to an emergency room after being found to have free air in her abdomen and after it was discovered that her liver wasn't disposing of toxins efficiently. As a result of those complications, Sarah was in hospital for a prolonged period of time. She's out now though, and she's coming after Dr. Roxy through her lawyer. A second patient, who we'll call Tanya, says that she never received any written post-operative instructions from Dr. Roxy after her BBL. And after her BBL, Tanya suffered abdominal pain, severe cramping and dark yellow urine. Her lawyer, James Arnold, says that Tanya was told by Dr. Roxy not to seek medical care. I'm under the impression that Tanya wasn't the only one to have received one such ludicrous instruction at Roxy Plastic Surgery. Dr. Roxy didn't want to lose her licence, naturally, but that's what happens when you have patient after patient of yours checking into an emergency room after surgery that you performed. Amber Runyon, for her part, has filed a lawsuit against Dr. Roxy because of the complications that she suffered after her surgery relating to her surgical drains. In many procedures, surgical drains are crucial to the healing that takes place in the first 48 hours after a procedure. Amber reports that the drains that were implanted into the incisions that were made during her breast surgery and tummy tuck with Dr. Roxy didn't work properly. And she says that when she called Roxy Plastic Surgery to ask what to do about the problem, they told her not to go to hospital. As a result of the complications that she suffered, Amber had to take 2 whole months off work and, as at early 2023, as far as I'm aware, still can't stand properly, all because of the complications with her surgical drains. Amber said that Dr. Roxy's social media content convinced her of her trustworthiness and her skill. Speaking of social media, many of the reports about the 3 lawsuits that Dr. Roxy is facing have labelled Dr. Roxy a TikTok plastic surgeon. Any surgeon can join social media, but the idea that doing so somehow makes a surgeon more skilled and more trustworthy than a surgeon who isn't on social media and who therefore lacks any level of fame, which I think is implicit in the label TikTok plastic surgeon, is, as far as I'm concerned, completely false. Dr. Roxy's licence to practice was revoked with a vote of 7-0, with 3 members of the board abstaining. I can't tell you whether or not she requested a hearing to discuss her suspension on or before December the 17th, 2022. That was the deadline for that request. I can't tell you because I just don't know. And I also can't tell you anything about the progress of the 3 lawsuits that Dr. Roxy is facing. Dr. Roxy's social media fame went to her head. She came to see herself as untouchable or bulletproof and never honestly expected to face any serious consequences to the reckless behaviour that she showed both in and out of the operating theatre. That's my personal and totally non-expert opinion. If you've enjoyed this video, then I recommend you to watch this one next. I'll meet you there.